All right, everyone, it looks like we are live. Thank you, everyone who is attending today. My name is Alex Sorotsky. I'm one of the public health educators at the Washington Poison Center. So, for any who don't know, Washington Poison Center is a pretty rad place. We have been in existence in some form or another for over 60 years. We do all sorts of things, but our bread and butter is our national toll-free telephone helpline. So we'll put this number in the comment section, but I'm just going to say it now. If you haven't done it, put it in your phones. 1-800-222-1222. We're literally always open, 2 a.m., 2 p.m. Give us a call. Someone will answer any question you have on anything potentially poison-related. So enough about that. What we're here for today, we're going to talk a little bit about some of our data. So a lot of what we do is crunching numbers. A lot of folks call us and we do our best to record all of that and follow those trends. And we've been specifically looking at some trends going on during COVID. So we did what we call a snapshot or a dashboard for some of our some of the COVID exposures, or exposures during COVID, I should say. We released our first one in May, and then we released another one just last week. And we'll share these links in the comment section there, but you can find these just on our website, and that's wapc.org. All right, so I'm not the only one you're seeing today. We are also joined by Gordon Morrow and Stephanie Garland. So Gordon, both of these folks are C-SPIs. That means Certified Specialist in Poison Information. That means they answer your calls. So if you give us a call ever, good chance one of these two wonderful folks will answer that phone. They also do some other specialized work. So Gordon's also a data analyst, and Stephanie is also one of the call staff leads. So without further ado, let's get going. So first off, Gordon, I'm going to ask you, what is it we're looking at exactly in this dashboard? What are we comparing?
So basically, the purpose of this was to try and take a look at exposures, and if we were seeing any particular trends on some likely candidates for increased rates of exposure during the COVID-19 pandemic period. And we basically compared the first, we basically looked at it as a number of days since the beginning of the year, and we compared 2020 to 2019 on this particular dashboard, just looking to see if there was anything dramatic that jumped out to us, and that was essentially the purpose of this.
Perfect, thank you. And are these totals, these numbers that we're seeing, are they cases or calls? Total number of cases or total number of calls? And what's the difference between those?
Well, these are cases. These are the count is basically a number that we track associated with a particular substance. So the dashboard represents exposures to the substance itself. We're counting how many times the substance was involved. One call may lead to multiple cases, or one case may have multiple substances involved.
Perfect. Thank you for that breakdown. And then before we go further, are there any data limitations that you'd like folks to know about and to consider when reading through some of the Poison Center data?
As with pretty much all Poison Center data that's based on calls, this is a self-reporting system, so we're only getting counts of the people who actually call us. And while we feel that it's probably a likely representation of what's going on out there in the population, there's a lot of people who don't call us, and so it's not an absolute count, but it is the best we can do with the way things work right now.
Perfect. Thank you so much. And I'm realizing, I don't think I said this earlier, to anyone and everyone watching, please ask any and all questions you have in the comments. We may not get to it with Gordon and Stephanie on. They have to sign off pretty soon. But I will stay on after they leave and answer whatever we can. All right. So Stephanie, we're now going to ask a little bit about bleach. So what is it we're seeing with bleach, specifically with misuse, and can you define misuse for us?
Yes, so misuse is when someone is intending to use the product and something goes wrong. So one example would be they didn't follow the proper instructions on the product labeling and it resulted in adverse effects. So an example with bleach would be not diluting it to the desired concentration prior to use. Another one would be not using gloves when using different products. You could also have misuse by inadequate rinsing of the agent. So if someone were using bleach to clean a coffee cup or a coffee pot and didn't rinse it out completely, that would be an instance of misuse. If someone were to pour coffee in there, take a drink, and realize it still had bleach in it. Going further with that would be that you could have bleach that was sitting and soaking in a container that looked like water. And so you walked by, it was sitting on the counter, took a drink. That would also be an instance of misuse. So it's the product was either in use or it had been in use and something went wrong.
All right, thank you. So what have we noticed with bleach misuse specifically looking at last year versus this year?
So there was a 62% increase in exposures of bleach misuse, which was significant. And it was noticed right away in the call room as we were taking the calls that this is very different than our normal trends and our normal amount of bleach misuse exposures. So it was very obvious. Another thing is it's just not only more common, it's different types of products even have been more common with misuse in general.
Cool, thank you. So what do you think are some of the best ways that folks can kind of reduce that misuse? How can they use bleach and other cleaners like that best?
So really reading the product instructions before using it. A lot of the over-the-counter products that are just on the shelf at the grocery store or different, big box, like Home Depot, Walmart, those types of places. A lot of times we consider them safe because they're not industrial, but really reading the product label and using it appropriately, and also storing the products out of reach of people that may be at more risk of mixing them up, such as not only small children, but also elderly patients or people with mental deficits or cognitive decline.
Perfect, thank you. There you have it, folks. So safe storage and read the labels. Big tips from us today. All right, Gordon, so I'm going to ask you a little bit about hand sanitizer. So why do we see so many hand sanitizer exposures for kids these days?
Well, not surprising. As Stephanie mentioned, this hand sanitizer kind of follows along very much the same pattern that we're seeing with other cleaners. Hand sanitizer in sort of the context of a global viral pandemic is something that's going to be, in high demand. If you tried to buy any hand sanitizer at Costco in the last couple months, you might have noticed that. It is something that is everywhere. We want it to be convenient. We want to be able to grab it and use it, at an instant's notice. It's completely not childproof. And so this is sort of a perfect storm for, a dramatic increase in pediatric exposures, small children in particular. And that's exactly what we saw. And the data that we have parallels what we're seeing nationwide with the national data as well. So it's not surprising. It's sort of a confirmation of what we kind of expected to see, but it is also a good area where we can possibly intervene and maybe make a difference here.
Gotcha, thank you. So what would you say are just some basic tips that adults in the home can follow to help protect kids in that same home from hand sanitizer exposure?
Yeah, because it's not childproof, and it would sort of defeat the purpose if it was, it's something we got to keep out of reach. And that's probably the biggest thing is find somewhere safe to keep it, be consistent in placing it there. Talk to your kids about it. Tell them, don't touch this, stay away from this. This is bad unless, mom or dad are helping you. It's basically common sense, but it's something that, it's easy to forget and to leave on a counter, and we see that quite a bit.
Absolutely. Thank you very much. All right, Stephanie, so I'm going to jump ahead a little bit, and I'm going to ask, when should folks call 911 instead of the Poison Center?
So if you call the Poison Center first, that's perfectly safe in almost every case, because if you do need to call 911, we will immediately tell you this is an issue for 911, go ahead and get them involved. However, most often we can manage things at home without any need for additional intervention, with just small steps that can be monitored and handled there at the house. If 911 is called first prior to the Poison Center, we would ask that you ask the first responders once they get there to give us a call, because a lot of times you won't need to be transported. The paramedics can check the heart rate, blood pressure, breathing, things like that. And often if all that checks out and there's no significant symptoms, we're safe to monitor you at home, and we can even do a follow-up call with you if you'd like. So that's something that often is overlooked, where it's an immediate reaction to call 911, when it's most often just as safe to give us a call first, and we can help triage and determine what the appropriate level of care would be.
Excellent, thank you. And that's something I didn't personally realize before joining the Poison Center, was that a lot of times paramedics as well as health facilities will contact us for that kind of consultation. So we do a lot, everyone. All right, so what I'd like to ask both Gordon and Stephanie, is to tell us a story essentially that is not conveyed in this one-page dashboard. So we'll start with you, Stephanie. What is something you'd like to share that this cannot?
So this dashboard has a lot of great information on it, but of course, numbers sometimes leave out that human element. And one of the things that I heard over and over while taking calls during these last few months were people using products they weren't familiar with. For one, particularly early on, there was a void of the Lysol wipes, Clorox wipes, those more easy use, quick wipe type products. They were hard to find on the shelves anywhere. And so people were turning to products that they weren't as familiar with. Bleach was one. Another one was vinegar, which we didn't mention before, but when you mix bleach and vinegar, that doesn't turn out too well. It creates an irritant gas. Another thing is that whenever people were using the products, they weren't reading the instructions because they just hadn't read the instructions on the ones they had used before. And so whenever you're using a new product, not reading the instructions, that leads to a lot of room for error and mishaps to occur.
All right, thank you. And Gordon, is there anything you'd like to add to that?
I would probably echo a lot of what Stephanie said. I would also say that something that we kind of notice, or I have noticed when talking to people, is a little bit of the decision process on whether or not somebody needs to go into the emergency room has changed a little bit as well, because there's a little bit of a different dynamic here where the impetus is to keep as many people out of the emergency room, and that's always our goal, is to keep people out if they don't need to be. But I think sometimes this can play into somebody's decision whether or not to call the Poison Center at all. And I would just say, we are aware of this situation, and that we are taking, the emergency room and the likelihood of possibly contracting a disease while you're there. We take that into consideration as well when we make our recommendations. So I would say that don't allow a fear of getting sent to the emergency room by the Poison Center keep you from calling us, because we do take that into account as well.
Excellent tips and insight from both of you. I thank you very much. So we've got a minute left, folks. I'm not seeing any questions right now, and that's all right. Send any that come to mind. I'll just kind of walk us through again some of our basic poison prevention strategies. So first off, store our number, 800-222-1222. It's okay if you don't have a Washington area code. You'll just get routed to a different one. They do the same thing that we do. Safe storage. You've heard both Gordon and Stephanie say this a lot. Storing things safely is key. That could be locked away. That could be out of sight, out of mind. And then also reading labels, only using products as they are intended to be used. Once again, give us a call anytime. Could just be to get some information. You get a new cleaner you're not as familiar with, you can call us and ask, hey, is it safe to use this for this? And then one little plug I want to add for masks specifically, because there's so many more masks these days, and it's important to wash them. Use soap and water. Don't use bleach. We don't want anyone breathing in any of those fumes. I'll also add a plug again just to our website. We've got a lot of recordings of our trainings there. We've got a lot of information along with this dashboard. And also feel free to contact us outside of the helpline if you're interested in more educational resources and opportunities. Well, it is 10:15 on the nose. Unless there's any last bit either of you would like to say, feel free to sign off if you'd like.
I think that covers it. Thank you, Alex.
Absolutely.
I don't think I have
Thank you so
anything
much.
more to add.
Perfect. Thanks, Gordon. Thanks, Stephanie. And I'll see you too soon.
All right.
Take care.
Thanks.
All right. Thank you. And I'll go ahead and stay on for another 30 seconds or so, maybe another minute, just to see if anything pops up. I'm not seeing anything now. And a big thank you to Megan King, who's been operating behind the curtain today. She's been looking at the chat box, putting the links here, put her little number there. So thank you, Megan. All right. Well, I'm thinking we should probably wrap up because I'm not seeing any comments or questions right now. This will be posted on our YouTube, and we'll try to share it on through social media as well. So as always, give us a call if you need. Thanks, everyone.